A Medicaid expansion bill is back in the Wyoming Legislature. House Bill 75 would give Governor Gordon's administration authority to come up with a Medicaid expansion plan, which the federal government would have to approve if it passed the legislature. 37 states already have Medicaid expansion. The Wyoming Liberty Group hosted an expansion pro and con panel Thursday in Cheyenne. Now, here are some of the remarks from both sides.
I think this is about people's lives, and I think that I will work very hard with legislators to provide common sense arguments that are based on fact that will really show that this is a gamble Wyoming should take.
Based on those of us who oppose Medicaid, looking at the 37 states, it doesn't look like it works. And I'll use an even more brief analogy. I own a biotech company, I do drug research, and if I have 37 test tubes in a row that the drug didn't work, I'm moving on. I'm not going to try that drug again.
It's estimated that 19,000 folks in Wyoming would enroll in Medicaid within 2 years. The cost for the first 2 years would be $154 million, with the feds picking up $136 million and the state $18 million. Lots of uncertainty here, folks, because these are just estimates by the Wyoming Health Department.
My biggest opposition to Medicaid expansion is obviously what it'll do to our state finances. I was elected to be a good steward of taxpayer dollars. 10% of a large number is still a large number, and we don't have that money. We are scrambling, scratching and clawing, looking under the mattress for quarters. We're not in any position to grow our state government at all. We need to be cutting our government.
In the next 5 years alone, we're projected to lose 1,000 more jobs. They equate that to about 4,000 people in the state that won't have employment. And what are they going to do? They're probably going to be forced to move to somewhere else. The nice thing about Medicaid expansion in this respect, if they're part of the community, they want to hold on, if they can have access to some part-time jobs to get them through until they can find another full-time employment in the state, and we can keep them here, that's great. Once they leave, we're not getting them back.
Naomi Lopez of the Goldwater Institute says when it comes to spending money on health care, you need to think about what that money is delivering.
But there are a lot of areas where you can actually improve the delivery of care at a lower cost and really break away from this idea that government spending is going to be some kind of silver bullet to what ails your healthcare system. It is not. What is going to actually fix the healthcare system is focusing on patient-centric solutions. And I think that is not what Medicaid expansion is going to provide.
Representative Sue Wilson says if the state expands Medicaid, other programs in the health department will have to be cut.
I am very concerned if our revenue picture is the same, that we would expand Medicaid and then tell the department to find that money, $20 million a biennium roughly, inside your agency.
Is the goal of expansion coverage or well-being? And it's really both. They're not mutually exclusive. We have an opportunity, I think, to work with our policymakers, our Department of Health, Department of Insurance, our folks at CMS to create a plan that works for Wyoming.
The full legislature has rejected all Medicaid expansion bills over the last few years. You'll recall the State House put its thumbs down to a Medicaid work requirement bill and a Medicaid study bill last year. Robert Jiha, Cowboy State Daily.